Welcome to Caregivers Note, a podcast on childhood disorders and other mental health conditions. The views expressed in this podcast do not serve as medical advice. I am your host, Nkukune, Dr. Tema, and this is episode 2, titled ADHD 2, the cause and effect. Below is a highlight of points that will be covered in this episode. First, ADHD as a developmental condition. Second, presentation and the cause of ADHD. ADHD is a developmental condition. ADHD is a developmental condition. Technically, people are born with it. This is related to causal factors which have been established to have direct link to ADHD. The first is genetic, in that ADHD is hereditary, and the other is related to exposure to toxins during pregnancy, especially nicotine and alcohol. There are, however, many other risk factors without a clear association, which could be either causal or exacerbating an already existing ADHD. The first presentation for clinical assessment is commonly during early school grades. This is due to the difference in the structure that is provided by the school compared to the routine at home. Preschool age also offers a good timing to attend assessment, though this is uncommon, despite obvious disruptive tendencies. It is also not uncommon to diagnose ADHD for the first time much later in life, adolescence through to adulthood. Things become much more complex at this point, though. The presentation would usually be colored by many other psychiatric illnesses that commonly present at these developmental stages. The other complication is the manifestation of conditions that develop because of untreated ADHD, as we shall describe in detail in our future episode. Presentation and the cause of ADHD. Presentation of ADHD is complicated by 3 major factors. Firstly, ADHD has 3 symptom clusters. This can present in various combinations. That is, all 3 present at the same time, or presentation of a single and or a combination of the 2 symptom clusters. The second complication is that presentation of ADHD changes with developmental stages of life. This unfortunately gives cloud to the misconception that children will outgrow problematic behaviors without intervention. This misconception is one of the most common factors that contribute to delayed attendance for assessment. The fact is that most people will outgrow hyperactivity and some impulsivity around early adolescence. Inattention and some elements of impulsivity will persist throughout life for most people. These are the elements that will continue to cause significant disruption in normal functioning. The third complication is symptom overlap from the other psychiatric conditions whose onset of presentation is in childhood. More often, there is more than one psychiatric condition presenting at a time in childhood. This would include autism, anxiety, intellectual disability, or even depression. It takes careful consideration of the context of presentation to clarify the primary condition causing significant impairment in function. With regards to the cause of ADHD, it is important to mention that it is not curable. It requires lifelong management for most people, with modifications according to needs at different developmental life stages. Presentation is much worse later, at a time when independence is supposed to be more established. It is at this time that most teenagers would be protesting about medication, especially if this routine had not been established much earlier. Most apparent challenges at this stage, even well into adulthood, have to do with self-management. This include management of time, self-care, and safety. This is discussed in depth much later in the episode on developmental trajectory of untreated ADHD. To summarize what we have just presented, attention deficit hyperactivity disorder, a developmental condition, though first presentation for assessment is usually at school age. There are multiple causal factors identified, and some with direct causal link, for example, nicotine and alcohol exposure during pregnancy. ADHD presentation is complicated by variable symptom cluster combinations, symptom overlap with other childhood onset psychiatric conditions, and alterations of symptoms pattern according to developmental life stages. This condition is lifelong in most cases, and possibly worse much later. In conclusion, earlier presentation for assessment will facilitate prompt access to appropriate advice, treatment, and necessary support. Delays in diagnosis, however, lead to detrimental and sometimes lifelong consequences. Prevention, as in the case of exposure to toxins in pregnancy, is possible, especially for those of childbearing age and where conception has been planned. Thank you for listening to Caregiver's Note. Do check out our website at www.nsztema.co.za for more resources, our contacts, and the author's profile. Please remember, the views expressed in this podcast do not serve as medical advice. Always check with your clinician for any medical concerns or clarity. If you liked this episode, please remember to share the link with those who could benefit from it. Tune in to our next episode when we present the good and the bad management approach of ADHD.